Hey there, welcome back to How to Medicate and welcome to this new video on how to use Olanzapine, also called Zyprexa. This video is part of a video series on mental health problems, and for those of you who want to keep learning, check out the playlist in the description after watching this video, of course. And for those of you I'm meeting for the first time, my name is Raoul, I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because I believe that medically educated people make healthier decisions, which is the whole point of this channel. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always contact your doctor. And now quickly, let's get learning. Now the generic name of this medication is Olanzapine, but it's sold under several brand names like Zyprexa, zydis and zypadhera. And it's available as an injection and a tablet. Which brings us to how to use this medication. If you want to use it as a tablet, make sure to swallow the tablet whole with half a glass of water. And for those of you opting for the injections, your doctor or your nurse will place them in your buttock muscle every 2 to 4 weeks, depending on the brand. Now for the duration of use, this usually depends on the specific indication as well as the severity of your symptoms. But if Zyprexa is effective, your doctor will prescribe it probably for 12 to 24 months and sometimes even multiple years. Now Olanzapine, brand name Zyprexa, is part of a group of drugs called antipsychotics, which have a blocking effect on several receptors in your brain. They block the serotonin, dopamine, adrenergic and histamine receptors. And they're used to treat several mental health problems like schizophrenia and a severe manic episode in bipolar disorder. Now usually I would discuss the correct dosages here, but unfortunately I can't provide you with any guidelines, as your doses differ a lot depending on the specific indication of use, the side effects you're experiencing and the severity of your complaints. Usually, however, your doctor starts off with a low dose and quickly builds up to your maintenance dose. Over time, your maintenance dose will be adapted based on the blood levels of olanzapine you will be having and your symptoms. Therefore, always use the prescribed amount and frequency your doctor gave you. Now, olanzapine can be a very effective drug, but unfortunately it also has some side effects. I will discuss the most common ones here, but if you're looking for a complete list, then ask your doctor or check your leaflet. Very commonly, olanzapine might cause sleepiness, a low blood pressure, weight gain and sexual dysfunction. Commonly, patients might experience an increased appetite, changes in your blood values, a dry mouth and a rash. And uncommonly, patients might experience an allergic reaction and a thrombosis. Now, considering safety, first of all, be very careful when combining olanzapine and alcohol, as this might increase the dazing effects of olanzapine. In addition, it can be dangerous to drive while using this drug, as it can cause you to become drowsy, sleepy and or dizzy. If you experience any of these side effects, then please do not drive. Furthermore, smoking cigarettes might decrease the effectivity of using olanzapine. Therefore, always discuss this with your doctor, and the same is true for using any other drug in combination with olanzapine, as both can have an interaction with each other. Therefore, always discuss this with your prescribing doctor. And as always, we end these videos off by taking a look at the safety when pregnant or when breastfeeding. Unfortunately, olanzapine can often be used safely in both cases, however there are some exceptions. Therefore, always discuss this with your prescribing doctor. Now I hope you know now how to use olanzapine, but if you have any questions, let me know in the comment section below. I will do my best to answer all of your questions, and for those of you who want to keep learning, check out my playlist in the description or up there. Furthermore, I recently made a Patreon account for those of you who want to support the channel. Thank you Sebastian, who is an investor tier supporter, and thank all of you for watching this video. If you did learn something, then please leave a like and consider subscribing, as this will enable me to keep educating you on important medical topics. And lastly, before you go, I also made an Instagram account at How to Medicate. I'm posting there a few times a week, so check out my content there. Thank you all for watching, and as always, I will see you next week with a new video. Bye bye.